Across the world, medical science has made enormous strides in the treatment of cancer. What was once considered a fatal diagnosis can now, in many cases, be managed effectively thanks to years of research, innovation, and clinical advancements. In the United Kingdom, a new breakthrough is transforming how cancer patients receive one of the most promising forms of therapy, immunotherapy. This change, introduced by the National Health Service, is not a cure, but it represents a major improvement in how treatment is delivered and experienced. Today, we explore how a faster, more efficient way of delivering the immunotherapy drug, nivolumab, is reshaping cancer care in Britain, and what it means for patients, families, and the healthcare system. Cancer has been known to humanity for thousands of years. The earliest documented descriptions date back to ancient Egypt and Greece. For centuries, treatment was limited, often experimental, and largely ineffective. The modern era brought with it chemotherapy, radiation therapy, and increasingly precise surgical interventions. These techniques offered real hope, increasing survival rates and allowing some patients to live cancer free for many years. But even with these tools, certain cancers remain difficult to treat, particularly those detected at advanced stages. That's where immunotherapy entered the picture, offering a new way forward. Immunotherapy represents a significant step forward in oncology. Instead of attacking cancer directly through drugs or radiation, immunotherapy enhances the body's own immune system, enabling it to identify and destroy cancer cells more effectively. One widely used immunotherapy drug is nivolumab, which has been approved for the treatment of multiple cancer types. It works by blocking certain proteins that prevent immune cells from recognizing and attacking the cancer. Until recently, patients receiving nivolumab had to undergo intravenous strips, which typically took up to an hour per session. These sessions were often repeated every few weeks, requiring patients to spend long periods in clinical settings. In a major development, the UK National Health Service has introduced a faster method for administering nivolumab. Patients who previously required an hour-long IV infusion can now receive the same treatment through a simple injection. The injection takes only 1 to 5 minutes to administer. The change does not alter the effectiveness of the medication. Rather, it modifies how it is delivered, providing the same therapeutical benefits with significantly less time spent in hospital. This is more than a convenience. It represents a meaningful improvement in patient care, hospital efficiency, and overall healthcare delivery. For many patients, the new delivery method will make a profound difference. Cancer treatment is physically and emotionally demanding. Reducing the time required for therapy helps alleviate one of the many burdens patients face. Instead of remaining in hospitals for extended periods, they can now receive treatment quickly and return to their normal routines. This means more time at home, more time with family, and less disruption to daily life. The benefits are not limited to comfort. The psychological effect of spending less time in clinical settings can improve a patient's overall experience and outlook during treatment. According to a Times of India report, this change will affect approximately 1,200 patients each month in England. That includes both newly diagnosed individuals starting immunotherapy and those who are already on the IV for nivolumab. Clinical estimates suggest that about 40% of existing patients currently receiving the IV version of nivolumab are eligible to switch to the injection-based alternative. This innovation applies to patients undergoing treatment for 15 different types of cancer, including skin, bladder, and esophageal cancers. It's important to note that the injection format may not be suitable for everyone. Treatment teams will assess eligibility based on medical history, cancer type, and individual patient responses. But for those who qualify, the impact can be substantial. Clinical trials have confirmed that the injectable version of nivolumab is just as effective as the IV drip format. It follows up studies. In follow-up studies, the majority of patients expressed a preference for the injection method, citing both the shorter duration and reduced physical discomfort. The outcomes remained consistent with previous treatment protocols, ensuring no compromise in care quality. Patients also reported feeling more in control of their time and health, with fewer disruptions to their work or family commitments. The benefits extended beyond the patient. The National Health Service itself stands to gain significantly from this transition. The new delivery system is expected to save the NHS approximately 1,000 hours of treatment time each month. These freed up hours can be reallocated to provide better care for more patients, reduce appointment backlogs, and streamline the overall treatment process. This represents a more efficient use of healthcare resources, ensuring that limited clinical staff and infrastructure can meet growing demand. Perhaps most importantly, these changes have been implemented without increasing cost. The NHS has successfully negotiated pricing with the manufacturers to keep with the manufacturer to keep the injectable nivolumab cost neutral compared to its IV counterpart. This ensures that financial pressure on the public healthcare system remains stable, even as patients receive a faster and more convenient treatment. This advancement is part of a broader trend in modern medicine, making treatments not only more effective but also more humane, efficient, and accessible. The NHS has long been at the forefront of adopting patient centered innovations that improve quality of care while managing costs. By integrating new technologies and methods like this, the system continues to adapt to modern needs and expectations. What we are seeing is not simply a change in medical protocol, but a strategic evolution in how cancer is treated in a national healthcare context. While this development is encouraging, it's important to remain realistic. Cancer continues to be a complex disease. A universal cure has not yet been found. But through changes like this, the treatment journey becomes more manageable. Patients can lead more normal lives during therapy. Hospitals can serve more people with better care. And researchers can continue focusing on long term solutions. Advancements in personalized medicine, AI assisted diagnostics, and gene targeted therapies are already in development. Each step forward, however incremental, brings us closer to more effective, less invasive, and ultimately life saving interventions. The introduction of injectable nivolumab in the United Kingdom marks a meaningful step up in the ongoing effort to improve cancer care. For patients, it means less time in hospital and more time living life. For healthcare providers, it means improved efficiency and resource allocation. For the country, it reflects a commitment to modern patients' first treatment models.